Hello, everybody, and welcome to another Pilates Hour. It's great to be here, and I'm especially excited to have a dear friend and colleague. Monica Larcada is with us today. Monica is a Polestar educator and faculty. She runs the flagship studio down in Miami, Florida, for us, and does a great job leading a team of beautiful Pilates teachers and physical therapists. Monica, it's great to have you on. This is a special one for me because it's so close to me, and I want to thank you for having the courage. And you're always so courageous. So I know this is sort of like whatever. We'll just go out and knock this out. But not everybody is as brave as you are. Um, let's see. What else can I tell them about Monica? So Monica did not come from a movement or dance background. She came from a work background and was a perfect example of those who have done a career transition and found a passion. And she certainly has a passion for the Pilates. This month is Breast Cancer Recognition Month. It's time for us to we're at the last day of it. We wanted to do this earlier, and my travel schedule has not allowed us to do it. We also just got finished with a large move that Monica has sort of been leading into our new space. We remodeled it, and it was a lot of work. And during this whole time, Monica has been battling breast cancer and doing a great job and being very stalwart with it. Monica, I would love for you just to take a few moments and share with everybody your journey and the highs, lows, and everything in between, and where you are right now in this journey. And let's see what comes up. If somebody has questions or comments, again, there's an open forum. I'm sure that Monica could benefit from some of you who have successfully gotten on the other side of breast cancer treatment and have survived and are doing well. And likewise, if there's questions about it, we're going to look at some research today that's out there regarding Pilates and breast cancer, and just open up the forum so we can talk about, what's going on. I see like Catherine Connor said that she's a fellow survivor of 35 years. And this is the kind of stories that we're excited to hear today. So, Monica, tell us about your story.
Thank you. Thank you, Brent, for having me today. Looking forward to it. So, as Brent said, I came into this Pilates world from the corporate world. So, I started with Polestar in 2018. So, here we are, teaching classes, privates, being an educator. So, love it all. And basically, the past year, I just felt off. Something was off, and I couldn't really pinpoint it. I was having neck issues, rib cage issues, shoulder issues, and I thought it was from playing tennis. I'm not that good at it, so thought it was that. But things kept adding up. I wasn't sleeping well, and I always slept well, so I knew something was up. And believe it was July 1st of this year. Brent was working on me, and we realized that my chest and my armpit was very tight on the right side. So that night I went home and I tried to recreate kind of just opening up my chest and my shoulder, recreating what he was doing that morning. And just from the palm of my hand, I was able to feel a huge lump. And I knew right there, I was like, this is what's been causing all the ailments and all the weird things that have been happening. So I right away called the doctor. Luckily, I was able to get in with my OBGYN within, I think it was like a week and a half. And he dismissed it. He said, "Oh, it's nothing. From my experience, it's a movable lump. It's smooth, so you should be good." And I said, "Okay, but we're still going to do diagnostic testing." So I called the diagnostic center and I was able to get an appointment within 3 days, which is unheard of. So I was so lucky. God has been on my side the whole time. So, anyways, as I got in within 3 days, and the rest was history. Within a week, I was diagnosed with um, invasive ductal carcinoma, and I'm estrogen positive and HER2 positive. HER2 positive is not the most ideal situation. It is pretty aggressive, but on the other hand, it's completely treatable in that we live in a day and age where there's so much research and so much targeted treatments. So the good thing with HER2 positive is that there's specific immunotherapy and chemotherapies that target. So we've done all the testing, we've done everything. As of right now, I'm stage 1. It hasn't even trickled to a lymph node. But the tumor was large enough. It is about 2 centimeters, which after the first chemotherapy, it completely disintegrated. So it's super cool. But I do have what they call multifocal disease, which is one big tumor and a couple, I think I have 3 satellite tumors surrounding it. So because of that, the treatment protocol was chemotherapy followed by surgery. Chemotherapy, immunotherapy, surgery, and then continued immunotherapy for about the next year or so. So that's where I'm at right now. I've had 3 treatments. So 2 chemos, 2 immunotherapies. No, I've had 4 treatments. And I have 2 left. So I'll be done Thanksgiving weekend with chemotherapy. So that's my
That'll be a
journey.
good day for Thanksgiving too. I know
Yes.
that, you know, we've noticed that you come back actually pretty well. You have a couple, 3, 4 days that are brutal, and then you come back and I'm assuming that that's extraordinary, Monica, because you're extraordinary. But that, you know, we recognize that those interventions just, you know, take the steam out of your engine. And, you know, one of the things that I want to talk a little bit about is actually how you feel about Pilates as your intervention for movement, even when you're not feeling well. Like, what have you done? How has it helped you? What are some things you've observed?
So I actually got this idea from you. So right after chemo, uh, you get very nauseous and it's not fun. And you don't want to do anything. And at least in my world, and for me, I get very small. I get the shoulders forward, the neck forward, the round back. I get very small. And so it's very hard to like wake up and finally like stand tall. So I was actually talking to you one day and I was like, oh, the reformer. Mm-mm. Just because of the moving out and in and the nausea, not going there those couple of days. But you said lie in the trap table, just lie down. And to me, that's the most amazing feeling going from really little to just like lying down and just feeling the spine decompress. And you're just, the floor is your savior. So you're just like melting into the floor. It feels so good. And after being there for a couple minutes, you're able just to start moving, just to do your pre-Pilates, your pelvic clocks, your retraction, protraction, and all of that slowly starts to just, it starts to wake up your body. I think I messaged you one day and I was like, I finally feel alive. And
Yeah.
that was from all of that, from gently waking up each part and then bringing it all together and so that you can finally move
You know,
everything.
we had worked with a group of women that were in the process and also in the survivor category down in Miami before they sold and went to Baptist, or the new Baptist Center opened up for cancer, which is quite amazing, and they've treated you so well. And what we realized is we had certain patients who would come in and we'd have a reformer class, and they would come into class and they would usually just lay on the reformer and not do any movement, but they were so happy just to be somewhere that wasn't medical, and it was something that they could be part of that social group that they had and also be on the machine. The machine represented that they were, you know, that they could be present, I think, is what's so important. And I love that you said, you know, feeling how that table, and it is an amazing feeling to lay on the trapeze table and to feel that openness, and to even have the tower bar. If you grab onto the tower bar, just to have some kind of movement, and the spring does the movement, doesn't have to be much from you, to be able to make that happen. I really like that. What are some other things that you're looking at now in the near future as far as your intervention? So when the chemo finishes in late November, what then? What happens then in your journey?
I keep with immunotherapy for 12 more sessions. Hopefully not with the same repercussions as chemo. And then I'm looking at within 4 to 6 weeks, I'm having surgery. And I've decided I'm going to go the mastectomy route. We're going to remove at least one breast, the right one, if not both, but the surgeon is pretty adamant that a single mastectomy is where I need to be because of the risks outweighing the benefits. And as soon as I got that, as soon as the last time I went to the doctor, to the surgeon, I saw you and Elizabeth right after, and something that you said really struck to me, and it kind of helped change my perspective. And what you said, I don't know, not in these exact words, were we always want to maintain the integrity of the body to the best of our ability. And I was like, yeah, that's true. We don't have to be taking things out that we don't need to take out. So I'm kind of there right now.
Yeah. Yeah. I'm glad to hear that. And I think it's such a personal decision and everybody's a little bit different. You know, with the stage that you were diagnosed and the prognosis being so good and your early intervention, you also have an uncle that has been influential, at least in coaching you through this process, that was an oncologist in Miami, and being able to have the confidence. And this is something too I want to talk about a little bit. I remember studying, doing a training with Deepak Chopra, and they brought in a complementary oncologist, like somebody that is an oncologist but deals with complementary medicine. And he wrote a book on it. I remember buying the book and reading the book. But the key takeaway was once you find your team, your medical team, I think I told this to you too, is like stick and trust your medical team and then put all your energy in, and as he said, quote unquote, take care of your garden. So it's like pull the weeds, feed the garden well, eat the fresh vegetables and fruits, and you know, take care of your family and be present and make sure that you minimize stress and all those things so that you have the greatest likelihood of, you know, successful outcome. And I always think of that as like, how do we create these type of environments? Now, obviously, there's a number of participants on today that have either gone through it or maybe just even as we encourage them to make sure that you get your regular test and screenings, because that's so important. The whole key is very early detection is by far the best prevention of long-term negative effects with it.
And I'm just gonna come in here. I'm not 40 yet, so I'm not eligible for regular mammograms. So I think it's even more important for us in our 20s and our 30s to
Mhm.
be even more vigilant. Bolo, be on the lookout. Every month, put a calendar request in your phone or wherever you do your organizing, because imagine if I wouldn't have felt that.
Yeah.
Who
6 months.
knows? Yeah, 6 months, it could have been it could have been everywhere.
Yeah.
So especially for us young women, we have to be even more vigilant.
Yeah. There was a comment from Amanda Lukowski. Thank you for sharing this, Amanda. I mean, I think again, anybody sharing information, we want you to know it's very respected. We appreciate your transparency and sharing. But her BRCA2 was positive, ended up with a double prophylactic mastectomy, and that's what led her to Pilates. And I have a dear friend in the community that was a news announcer, and she also had the BRCA too, and she did a prophylactic bilateral mastectomy and reconstruction. And you know, everybody's going to be a little bit different depending on what is manifest. There's different types of breast cancer. There's different locations of it. There's different stages of it. And again, I like the word you use, the BOLO, to be on the lookout for. You know, it's like making sure that we're looking at these things, taking them seriously, and just because insurance and the standard medical practice is saying that, I think what we don't realize, I was looking at it earlier today with Elizabeth, at what are some of the myths and what are some of the true factors that influence or increase the risk factor of breast cancer. And, you know, we always look at two factors with almost every disease. We look at genetics and we look at environmental. And so if anybody knows they have genetic predisposition or they have somebody in their family that does have the BRCA2 positive, you know, it is worth getting tested early, and, you know, your quality of life and your longevity far outweigh some of the things. And we're going to talk a little bit about aesthetics in a little bit, because I know that was one of the concerns with the single mastectomy was the aesthetics or the difference of a reconstruction of one side, not the other. And as Pilates teachers, we want this perfect symmetry. And, I think that we have to put that on the back burner and think of this whole body health and the beauty within. Like I love India Irie's song where she talks about, how the one about I am not my hair, of course, which you and I can both appreciate that now. You have a little more compassion on me with no hair. I've been wearing a hat whenever I'm around you, so that your hat seems normal. But today we are going hatless and proud of our beautiful heads. And my dad used to say, "Oh, God only made so many good-looking heads; the rest he covered up with hair." So you have joined that club, Monica. The good news is your hair is going to come back, and it's going to be beautiful and long like it was before, and mine will still be gone. So I can enjoy my chinny. Hey, I have some research that I want to share with everybody. And again, I found just in the last, and just so everybody knows, like we basically print up every year all of the new research in Pilates. And this particular year, there were 5 studies related to breast cancer, which I thought was pretty darn impressive. So I'm gonna um, share some research with y'all. So I have like 5 studies here, and nothing is amazing. There's somebody down in Brazil that is excited about um, the idea of this research, and I think it's good to be excited about it. I'll draw my conclusion a little bit later as we look at these. This particular one was looking at mat Pilates improving lower and upper body strength and flexibility in breast cancer survivors, which I think this was probably the most strong study that was done down in Brazil. And it was published in the Disability and Rehabilitation Journal. We'll share these with everybody afterwards if you want to look them up. This one showed that, and this makes the most sense, that there was a significant improvement in things like shoulder girdle organization and things after mastectomy and after radiation and after chemo, that they were able to restore a lot of that flexibility and strength in the upper extremities that were affected by the breast cancer, as well as lower extremity dysfunction. So I don't think that's a surprise to anybody, at least not on our website, that we would find that as being a positive outcome. The next one was looking at mat Pilates improves lower and upper body strength. Let's see. Let me just check something here. Yeah. So mat improved lower and upper body strength, flexibility in breast cancer survivors undergoing hormone therapy in a randomized controlled trial. And again, this one showed that they were able to increase their strength. I didn't think this study was real strong, but it did show that there was an increased strength in the upper extremity and the lower extremities, which again, we would expect with any kind of exercise regimen. I think the difference here is that when somebody's dealing with something like cancer, you're dealing with a lot of loss of energy, fatigue, deconditioning. A lot of the immune system gets affected, and so there's less ability to build strength until a lot of the hormones and the immune system regulate following these kind of treatments. So it takes a little while, it takes a little bit longer to get the muscle strong, but it certainly makes sense that it would be a healthy environment for somebody that is surviving cancer in treatment to be able to maintain some range of motion and some strength. The third one was effectiveness of mat Pilates on fatigue in women with breast cancer submitted to and it says adjuvant radiotherapy. I'm not sure what adjuvant radiotherapy is, but I know what radiation treatment is what I'm assuming they're doing. And they did a randomized clinical trial. Again, all of these were done down in Brazil with the same group of focus, looking at particularly at a group of women with breast cancer. And this was looking at fatigue in particular. And what they showed was that it didn't necessarily reduce their fatigue. There was not a significant finding that it reduced their fatigue while they were underneath the treatment. I think the main thing is that there was not a significant outcome in reducing perceived fatigue with women that were going through radiation therapy. And this is really important for us to understand, where it's not a miracle treatment. What we do with Pilates is we can create an environment that can match the load tolerance of the individual or of our patients. And so somebody that's dealing with a huge fatigue manifestation or symptoms, we can create that gentle environment that they can just be there. They can do subtle movements and feel like they're doing something, even though they are really at a loss for energy. So this one was looking interestingly at the effect patients reported in their breast cancer doing mat Pilates and belly dancing, and the outcome actually was good for both of them. So again, I don't want to isolate one thing being better than the other. The idea of having successful movement did have an effect on outcomes following breast cancer in adherence to these exercise regimes. So it didn't really matter if it was belly dancing or Tai Chi or Pilates or yoga. I think the key is to find a safe exercise mode that they can participate in that would not be disrupting any of the treatments or surgeries that they might be going through. And then the last one was, can mat Pilates and belly dancing be effective to improve body image, self-esteem, and sexual function in patients undergoing treatment for breast cancer? And this one also was a randomized trial. It did not show any major difference in most of the outcomes. It did show that the belly dancing did have a slightly better effect on self-esteem and body image, which probably would make sense if they're dancing in front of a mirror and they're moving their bodies and being visible with it. That could definitely be something that that does that. And again, what I would say is people are having good, positive experiences with the Pilates or are really finding beauty inside themselves and finding the success of being internal feedback and internal locus of control versus being worried about that. But that's where I'd like to go. I'd like to talk about that a little bit. And I'd like to talk about that, and this is an area that, I'm familiar with it from a standpoint of when I was getting ready to have my hip replaced. And I've shared this story before that, the doctor was like, look, your hip is really, really in bad shape. It's been through surgery already. You had a dislocation. There's no cartilage. It's causing back problems and knee problems and other problems. You really need to replace it. But I want to know what you believe. And I said, well, I believe in being whole body. And then he says, well, my wife has gone through your training and I hear you teaching all the time on the videos, Brent. And the thing that I hear over and over again is whole body function more than whole body appearance or look. So I'd like to open that dialogue up of, how maybe some of our listeners, how you're sort of perceiving the challenge that you were given from your surgeon of doing unilateral mastectomy, that pertains to this idea of body image or perception of wholeness versus the perception of whole life and healthy and those kind of things. So I'd like to open that up, and I think that this is an area that I cannot understand. So I am relinquishing this to you, Monica, and to the women in the audience that have had breast cancer and have had these kind of treatments, as to how can we as Pilates teachers help restore the confidence in the body when the body has been insulted like this, like when there's been a radical mastectomy or you're expecting one. So I'm going to turn the time over to you. Please answer questions or add comments. Anybody that's out there, feel free to do so. Monica.
So for me, what helps me feel more balanced?
Yeah. Yeah. Well, like just sort of maybe the fears and the perceptions of, in December, January, you'll be going through a surgery somewhere a couple months after with chemo. And, what is your expectation? At the same time, I know there's participants that have been through this out there that it'd be nice to hear their feedback. I saw Sandra Spear said something, and Sandra's an old-time friend of ours. I haven't heard from Sandra in a long time, but made an important comment about also being aware of the different types of plastic surgery afterwards too. So being conscious of what that is doing to our bodies. So I'm going to turn it over to you and maybe share a little bit of that, and our listeners can certainly contribute here.
So my biggest fear, I was very adamant at the beginning that I wanted a double mastectomy, but I think I was also a little bit misinformed. I wanted a double mastectomy because I wanted it all out. I'm a little bit grossed out by my chest right now, just because how could it be so rude to me after I've treated my body so well? I thought I was the healthiest the healthiest. I eat well, I don't drink. Everything that I put on my body, I read, I make sure they're clean products. I eat well. I mean, so anyways, I wanted them both out because I don't feel good with them. Um, and then the surgeon was explaining to me all of the things, and one of the things that really stuck out to me was the rejection of foreign objects, which is I think where Sandra was going towards with her plastic surgery comment there. And there's a big movement and whatnot about the rejection of the foreign object. So that does scare me. So if I only have one, then I only have one to worry about. But I do have a big fear of being uneven, not honestly, not so much aesthetically, because those things can be fixed with bras and whatever, and wearing the right clothing, but feeling. I'm very in tune with what's going on, and if I have one side heavier than the other, which I don't even know if that would be a thing, that does scare me. And then I have a lot of neck pain and I have a lot of discomfort here. So how is that going to impact me on a day-to-day basis and with my work that I do? So that does scare me. So if anybody does have any advice, I would appreciate that.
I see some local Miamians speaking up here and others that are willing to chat with you. So we'll make sure we have all this information copied down. I think having
Awesome.
somebody who's been through and survived is always a nice kind of mentor and coach to have through this. And, one of the things that we see, Monica, and I know Elizabeth has seen a fair amount of this as well, and I typically have seen it long after the surgery and either with or without the reconstruction. And to me, the biggest thing is making sure that the tissues are moving and that, those of you that are tactile sensitive, like you feel, that my wife won't wear anything that has polyester or any kind of fake clothing. She's just super sensitive and wants cotton, linen, and silk, and that's it. And she can tell a mile away if somebody's wearing a polyester shirt or pants, and she freaks her out. So I think when you're sensitive like that, tactile sensitive and material sensitive, that it's going to be a bigger challenge as far as those things. I think, with having one of my best friends in Miami is a very well-known plastic surgeon, Dr. Sarer, and talking to him and getting advice as I was working with some of these patients that had gone through reconstructions, and even having observed a couple of the surgeries with him, it was pretty impressive to me that how a good surgeon can create as close to similar. I have a very dear cousin of mine that also went through a bilateral reconstruction and was stage 3, and now is 20 years surviving. And looking at what I see the biggest challenge was the scar tissue maintenance and making sure that it's addressed early and appropriately, not too aggressively. Like there's a lot of things with scar management and those things that can really make a difference in the outcomes. I'm looking at some comments here on the side that I would love to share with everybody. I think this is what today's all about. Sandra Spear said, I'm happy to connect and share also my experience in surgery with Monica. Please feel free to call me. Thank you, Sandra. And then we have Amanda Lukowski says, Monica, I did have the rejection issues, and that what made my really hard 7 surgeries. I would ebb willingly to chat with you also, so that's nice. Beatriz is my cousin, and she says, I guess for me, it's always a struggle between body image and health. And I guess it is totally normal and accept it as it is. I try to navigate through it and focus on feeling well, exercising, and improving my movements, which, Beatriz is basically quoting what our goal is in Pilates, isn't it? Like, especially in Polestar. How do we navigate function? How do we navigate our abilities? How do we navigate regular exercise and healthy movement and healthy participation in life? And what I found for me with the hips, for example, was that same thing. It's what made me decide to have the hip replaced, was because I was not able to participate. And in this case, this is a life-threatening kind of thing that if you didn't take care of it correctly, you wouldn't have longevity to participate in. And so, the first and most important thing to me, and I was thinking, like, if Monica was my sister or my wife or daughter, what would I hope for, right? And I would hope for longevity as being the number one thing, right? How do you get to longevity? So thank you, Beatrice. Um, let's see a couple of things here from Amanda again. Put her connection in there. I wasn't advised to move or subscribe PT, and that was part of the problem. And I've seen this, Amanda, is that sometimes the medical professions don't realize the power of a good manual therapist or a women's health therapist or a myofascial therapist that can really manage the scar tissue. And especially if there is, you're not going to deal with this, Monica, but with radiation therapies, the radiation can do a lot of damage to the skin and to the healing and make it very hard to get the scar freed up from the chest wall and some of those kind of things that we've dealt with. So in those cases, the earlier intervention, the better. And like Amanda's saying that she wasn't prescribed that. And Monica doesn't even have a choice on that one because she's going to have like four of us making sure that and she'll do it herself. So she's going to push it herself. Great advice, though. Any thoughts as these people are talking to you, Monica?
No, it's just lovely. One of the best things about Polestar is the community and how the community comes together. Part of the healing process is coming to work. Every single person that walks in through that door and is part of the team and is just full of love, and they're just amazing. And same here. So thank you.
Yeah, it is. And it's all over the world. I see a note here from Catherine Pinnell. She said, my mother's a breast cancer survivor. She is not. One of the biggest challenges about mastectomy was losing an aspect of her femininity. It is emotional, and this may not be the venue to discuss too much, but something that came to mind. And I would agree that, anytime something, and this is why I'm curious as to your experiences, what Monica is experiencing now, what she will experience with a mastectomy, what those who have been through it have experienced. Is, I think as a male, to me, my biggest concern is not the aesthetic aspect of a breast surgery or a mastectomy. And I could be different in that sense because I'm medically trained and I'm also just not that kind of person. Like I'm much more attracted to the intellect and to the beauty within and all those things. But I'm curious as to how much that plays into this of the idea of femininity and does can you have full 100% experience of femininity after having a mastectomy? And I would assume the answer to that is yes, but I'm curious as to what you and some of the audience are dealing with and what the thoughts are around that. I mean, you were ready to go bilateral and like just take care of this business. I'm offended by these babies and I want them gone. Um, but what's your thought on that?
I don't know. I think femininity comes from inside. So yeah, it'll be hard to look in the mirror, but it's hard to look at the mirror right now without hair. But I think the whole losing your hair helps because you do realize that beauty and everything, it's inside. It's hair doesn't define you. It doesn't define your beauty. Yeah, it's not fun. But on the bright side, I can work out before coming to work. I can go to the sauna and I go outside walking the dog and it feels really nice.
So,
So
now you know why I shave my head, right? It's like, oh yeah, that's why Brent does that. Not to
it
mention I'm bald, but
it feels really nice. So I think that's leading the way into the mastectomy. It'll be different, but I don't know. I'm not concerned right now.
mm,
Maybe later I will, but right now I'm not.
that's
One step
awesome.
at a time.
Yeah, one step at a time. Well, you definitely are beautiful inside and out. One of the things that I wanted to sort of close up with today is the importance of encouraging as practitioners. Everybody on here pretty much are practitioners or survivors, and have benefited from Pilates and movement and exercise. And the one thought that comes to my mind is how do we do a better job of being promoters and encouragers of our clientele And not just for breast cancer. I mean, obviously we're talking breast cancer this month, but there's testicular cancer, there's prostate cancer, there's ovarian cancer, there's cervical cancer, there's all kinds of other diseases, heart diseases, autoimmune diseases. Like, how do we do a better job of encouraging people twofold? One, to live a healthier life, sort of like what you talked about having done, which I can guarantee you has definitely blessed you through your process of dealing with a cancer, of being a healthier individual. But, also more importantly, just how do we make sure that our clients are listening to their bodies? And, this is something big. I leave tonight for Istanbul, so I won't be with you guys next week, but I go to Istanbul and it's our first World Alignment Tour, or Align the World Tour. And the purpose of it is to get people to be aligned in their bodies first. For us as practitioners, how do we align ourselves? How do we have the sensitivity that you had, Monica, where you were able to feel and go like, oh, something's not right. I need to go get it checked out, right? Where a lot of women, I know like a cousin of mine, her whole problem, she knew there was something wrong. And she knew it was wrong for like a year. And by the time she finally addressed it, it was stage 3. And she almost lost her life. And, how do we make it? And it was more about being embarrassed to go in and, or the denial of something potentially being bad that would lead to something like a diagnosis of cancer. So, I guess what I'd like to put out there now is maybe talking about how we can do a better job of helping others be more aware and conscious and be more preventative and live a healthier lifestyle when we live in a world, especially in the United States, like you can't buy processed food that isn't filled with all kinds of carcinogenic things that are all illegal in Europe. They're illegal in Canada, and yet we seem to have a plethora of them all around us. How do we continue to promote that? And I'm open to anybody also in the audience too that might have some suggestions on that, because I think we could all learn from each other on this.
I think what I've learned teaching wise is as a teacher, I talk a lot, like I give a lot of instructions, and it's important to be quiet, not only for the class and to let them absorb, but I've learned now that if we're always talking as teachers and giving so many cues because we want the perfect class, da 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 da, the clients are losing the moment to feel it
Hmm.
and to feel what they feel. So I think it's important, and I've learned to teach, step back, and you don't even have to say feel it or whatever. Just allow them to be in the moment of silence or with music or whatever it is. And I think I need to work on facilitating that a little bit better.
Yeah, there has to be a time for, and this is what the movement is, right? For our alignment tour, it's like, how do we quit being teachers that are just providing external feedback? And we actually are creating space and energy for internal feedback and self-awareness and self-reflection. And we've seen this over and over again that, a young teacher is engaged in cueing vomit. We just say so many things, too many things. And where a more seasoned practitioner, I think of, Shelley playing the Libra act of, oh, that depends. What do you feel? What do you observe? What do you notice about this? Is it right or wrong? I don't know. It depends. What do you feel? And so always going back to that internal perspective, that internal reflection is where people are going to have the greatest self-awareness, more than when we're doing the testing, right? And somebody that's self-aware is going to go to do their annual screening. They're going to listen to their body and observe a skin lesion or something like that they're just curious about, and they notice that it wasn't there before, and they're going to go take care of it. I'm looking at a lot of really cool comments that came in while we were talking there, and Catherine Connor said that you are bold, bald, and beautiful. So you got the B cubed, bold, bald, beautiful. Carolyn Munich said, also, no shaving the legs, and you can draw on expressive eyebrows. My nieces love the quizzical brows. Maya says, I did virtual classes with Monica while doing my comprehensive training. and you are beautiful inside and out, with or without hair, with or without mastectomy. So there you go. Elena Volt, Monica, you look beautiful. Catherine Pinnell, I'm so glad that isn't the worry for you, Monica. And Rosanna, your colleague, said a pearl. Thank you. So I love the support that we have inside our community in Polestar and how important that is to us. Is it?
And one other thing about the community and about teaching. So many people have come up to me like, wow, you're so open, you're talking about it. You have to talk about it. I feel like when you come in, and we're not all women, we're about 75% women, but you have to talk about it. You have to let people know that it's scary, but you still got to do it. So I think being in a community and talking about it is really important as well, as part of the teaching and as part of Polestar.
Yeah, yeah, I agree with you. Um, we've got a few more minutes, and before we close down, I would like to just think of anything else that you would want to share, just with your last couple months in this experience that you could share with others that maybe um, have not, or they have family members that maybe have been diagnosed. So, how can we help you the most? Like, what's a role that we could play as supporters to women that are going through the breast cancer treatment?
I think just being there and not just being there. Constant messages of support. I have so many clients here, and Hilda, one of my colleagues here, they're always cooking for me. They're always making soups. So all of that, it's just being there for somebody and showing support. I think that's the loveliest. And I want to go back to something that you were talking about at the beginning, of something that you told me at the beginning about, we need to take on the role as healers. I think we've lived this life of fighting, 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 and a lot of people are like, "You're a fighter, you're fighting breast cancer." That's super counterproductive. We have to be healing, as you said, from breast cancer. And I think people supporting people, somebody with cancer, has to take on that healing role and that supportive healing role as well. We need to heal. We need to find whatever it is that allows us to heal and allows that person that we love how to heal. That's very important to me.
Yeah, I really like that. How do we're in a divisive world these days, and the word selection that we have is very important. And I remember having a patient that was terminally ill, and she did pass away way too young for her age. But what was beautiful about her is that she insisted that anybody around her only use positive, kind, beautiful language. And, even if they were, you know, politics came up or work or financial stress again, she was like, put the barrier up all the way around her. Like, I don't want any negativity. I want all of my cells to be blessed with positivity as they're going through this process. And I think that's such an important point. And, we're so glad that, you listen to your body and an early diagnose, early intervention, very successful prognosis in place. And still how important it is that you have that positivity around you. And, that we create the environment energetically for healing. I really like that. Well, I don't have much more. You have another thing
Oh,
I see.
yes, I want to bring
Yes.
up one more thing.
Yeah, sure.
So Brent taught us this wonderful class in North Carolina in the spring, and I use it all the time when I'm trying to wake up for my coma chemo weeks. And it's a mat class focused on our insides and how we're waking up our organs and all of this. So I want you to just talk about that in case that helps
Well,
anybody.
let's just do it. Everybody's probably sitting down somewhere. You could do it sitting on the edge of your chair. If you're on the floor, maybe go into a mermaid Z sit position. And what we want to think about are a couple organs in the body, right? And this could work for anybody that we're dealing with, kidney problems, respiratory problems, heart disease, cancer, colon issues, digestive issues, kidney, everything. So if we think of our anatomy, let's just do a quick anatomy lesson. We have our lungs, and our lungs surround our heart. So we can start with that first and just think of breathing in deeply and lifting the lungs up to the front, and then exhaling and letting it come back down. We'll do one more of those deep ones, inhaling around the heart, feel expanding and sort of hugging, embracing the heart with that inhalation, and then exhale. And then we're going to spin the lungs around the heart, spinning to the right, to the left, and let the breath happen naturally. But just imagine it's the organs moving. It's the lungs slipping and sliding around the heart. Let's do that a couple more times and just feel how when we allow the organs to do the movement, we actually get a lot more range of motion than when we're thinking muscles and bones. This also comes from my dear friend Eric Franklin. And then let's think of the next level of the body. So the lungs sit on top of the liver on the right side and the stomach and pancreas on the left side, and it's domed. So let's think of that really high of exhaling and just sort of sliding the lungs over the liver and the pancreas forward and back. So we're just sort of sliding over the dome back and forth. And really think of where that is. Like if you put your hands underneath the front of your ribs, that's about the height of where that liver is. And then we're going to slide sideways on that. So we're going to slide over to the pancreas and then slide over to the liver. And we're just sliding the lungs over that diaphragm, slippery. I would even dare to say it's a little slimy in there. And then we go down a little bit further. Put your hands on your low back, and that's where your kidneys are. So we're going to go into extension and flexion over the kidneys now. So it's a little bit lower, right? And do that a couple times. And then we're going to roll around the kidney. So we're going to spin, rotation. And then we're going to stay to the right side and then bend forward down to where the left kidney is exposed. And take a deep breath. And again, slide, feel that lung sliding and the stomach and pancreas sliding over that kidney. And then bring it up, still in rotation, come up into extension and sliding over that kidney. Back again over the left kidney, rolling back to the left, up in extension, rolling forward. One more time. And use your breath to really facilitate that too. And then rotate to the left, going back and forth over the right kidney. Inhaling forward, exhaling back. One more time. And then place your hand down on the bottom of the stomach, like just below the belly button. And imagine holding all of your viscera, right? All of the intestines in your hand, and just do a circumduction around the pelvis. So we're doing like a pelvic clock and sitting, and feel your gut, like let it be loose, and even dig your fingers in a little bit into your gut as you're doing that. So you're just sort of massaging the colon, massaging the colon. And remember, the colon comes up on the right. So we could move our hand up on the right. As we come forward, move it across the front. And as we go back down, down on the left. And keep going around in circles with the hands, coming around, sort of massaging in the direction that our food would be digesting. And then the last thing is, whether we have female ovaries or not, I'm going to pretend that I do, right? And the uterus, and just sort of feel where they are, or pretend where they are if you've had surgery or you're male. And just think of doing little tiny pulses over that organ. So the hand is in place, sort of if you were touching or grabbing the uterus, or just outside the uterus a little bit to the ovaries, and just sort of a little anterior posterior tilt of the pelvis. And you're just sort of opening things up around the organ. And if you go down a little bit lower, you're on the bladder. And you can do the same thing on the bladder, sort of feel the bladder pushing in and out and in and out. And then the last thing we can do is take our hands underneath our pelvis. We actually can feel the pelvic floor with our fingers on the inside, and we can just breathe down into the pelvic floor and feel like the sit bones are spreading apart into our hands, and then exhale, and feel the elasticity coming back up. So now making the connection between the diaphragm dropping down and the pelvic floor dropping down with a deep breath. Relaxing, relaxing, relaxing pelvic floor, and then springy trampoline coming back up, coming back up. Last time. Now bring the hands to your knees, and let's just jiggle all the guts and viscera. Just jiggle it around, like let it be elastic and all the connection. That's it. Take in one more deep breath. Let it out with a sigh, and you just did a organ mobility class for 10 minutes.
Thank you. Love
You
it.
know, we can always, and again, I give credit to Eric Franklin for that. He taught me how to use imagery of the organs and to move through the organs, and I think it's such a nice way to get away from always musculoskeletal kind of stuff. You know, it's like our muscles and our bones and our joints often hurt. If they're hurting too much to move your organs. And it's amazing at how the musculoskeletal pain can be reduced by moving the organs. And then I would say vice versa. You know, if you're feeling sick in the stomach, you're feeling a little nausea, you're feeling constipated, you're feeling hypertension, you're feeling difficulty breathing, move. Think of moving the musculoskeletal. You know, we always talk about the breath when we say breath facilitates movement and movement facilitates breath. So think of the visceral movement can facilitate musculoskeletal movement, and musculoskeletal movement can facilitate visceral movement. Yeah. Well, Monica, you are brave. You are a great example. And, you know, I'm so happy that you're halfway through this chemo, and be happier when you're done. It'll be a big Thanksgiving for us, and appreciate all you shared. I want to share just with the audience as well. Thank you for participating and giving your support to Monica. I think this is a beautiful community, and I know this is very transparent and intimate to be talking about these things, but we need to be more transparent. We need to talk out louder and raise more consciousness for that. So with that being said, Monica, thank you very much. Thank you for bringing these things to us, and we love you and we support you, and are looking forward to a speedy healing and recovery for you. Thank you, everybody out in Polestar Pilates Hour. We have some really wonderful things coming up in the next couple months that we've been anxiously engaged in securing some great individuals to share information with us and great topics. We thank you for your support. Please share it with your friends. Bring in the world physical, emotional, and spiritual alignment at Polestar. And above all things, we desire to have kindness and to be kind to others. So we'll see you on the next Pilates Hour. Thank you again, Monica. Thank you again, everybody. Have a wonderful weekend.